have a little information session about orthodontics, all the basic questions, everything. I'm just going to do the introduction. I used to do a lot of ortho. I've kind of passed on the flame to Damien. So Damien's doing all the ortho, and he's very, very passionate. So he'll be doing most of the talk and discussion about orthodontics and clear aligners and braces, all that. So just some basics about what we're going to cover, our team. So there's quite a few people who do orthodontics over here. We'll, just familiarize yourself with the faces. It's just easy when you walk in and you see people you've seen before. What is orthodontics? We'll discover clear aligners. Forget the M in between there, sorry, typo. And we'll discuss braces, clear braces or metal braces, whatever you choose, patient case studies, considerations, costs, and payment options as well. So that my practice manager, Tian, will cover in detail. Alternative treatments, getting started, and then questions, lots of questions, and then there'll be some nibbles. That's me. I've been the practice owner for a very long time now, more than 26 years of experience. We've been in Geelong for a very long time, so trust is big. That's the big thing with the practice. We've been on magazines and all that, and I've kind of gone more into implants now. So we've got Dr. Mehek, Albin, Prerna, Neil, Damien. So Damien looks like a kid in there. He's all grown up now. So Damien really only does orthodontics. So we all kind of specialize in certain things. And yes, I'm going to get him to talk about lots of things. Everything that we do, we are very onto the latest. So if it's available, we're doing it here. That's a promise. So, so it's not just about extraction. It's about what's needed. And every patient gets a customized treatment plan. So he will discuss everything with you in detail. He's fluent in English and Mandarin. Yeah, and he's got the Dean's. He's been on the Dean's Honor List and Therapeutic Guideline Award. I didn't know that. Oh. All right, Damien.
Thank you. Hey, thanks everyone for coming tonight. So quickly on what orthodontic is. Okay, so if you're breaking down the word, ortho means straight or to straighten, and dontics means teeth. So orthodontics really means to straighten the teeth, but it is a lot more than that, okay? So not only do we straighten the teeth, we are actually harmonizing the lower third of the face. Our teeth are housed in the upper jaw and the lower jaw. When we say orthodontics, really that's what we are looking at. We want to get a harmonized relationship between the teeth, the jaw, and the whole face, aesthetically and also functionally. It's a very intricate interplay of math, science, physics, aesthetics, and art to achieve the best aesthetics and also the best function, okay? All right, lots of indications for orthodontics. It can be for aesthetics, it can also be function. When the teeth are a bit crowded, orthodontics can help. Otherwise, spacing, orthodontics can help. Sometimes our front teeth on the top are quite far forward. That's where orthodontics can come into place as well. Likewise, when the lower jaw is in front of the upper jaw, we have a bit of an underbite. So that's a very good case for orthodontics as well. Likewise, deep bite where we're biting too strongly at the front, or open bite where our front teeth don't meet. All these cases are indications that we need some orthodontic work done. All right, so first tool we have for orthodontics will be the traditional metal braces. Metal braces have been in the world of humanity for a very, very, very long time. As early as 3,000 years ago, we've actually seen the ancient Egyptians putting on braces on the people to try to straighten teeth. Did it work that well? Not particularly, but it inspired the later generations to invent the modern brackets, or the modern braces. Over approximately 100 years ago, the first version of braces come to place, and now it's just been modernized and works a lot more efficiently now. It is the traditional way of correcting teeth and is very, very predictable and reliable. All right, so when we talk about braces, one thing that comes to mind will be the metal color, the train track on the teeth. We can have colors if that's what we're after, or we offer the clear braces as well for complex treatments that are beyond the scope of clear aligners, but at the same time doesn't look as shocking in a sense, okay? All right, let's look at an example with braces, okay? On top is what the teeth look like before the treatment. As we can see, quite a bit of crowding. One of the tooth is very high up, and at the back, we're not biting too correctly as well. With braces, 12 months, we are able to achieve pretty much a very good look and very good function, as we can see on the photo down below. Another example, this is what we call a deep bite, where the front teeth are really biting very deeply. In this case, the patient is pretty much chewing on her lower gum with her top teeth. Similarly with braces, the 12 to 18 months, managed to get a pretty much 100% correction on the right hand side. Crowding tends to be what people first notice when they say, okay, I need braces. Again, very efficient and fast with braces. From left to the right, took about 12 months. And much younger kid, very crowded. And to get braces, pretty much straightened everything already. Another 2 more months and the child will be done. The one good thing about braces is that it can really target the very complex cases. For this case, this is an adult. From the x-ray, we can see that 2 of her teeth are actually buried deep under the gum, under the bone, and are literally stuck under the nose. With braces, what we can achieve is that we can actually guide them into the correct position. In this case, won't lose 2 teeth, don't need implants, and functionally and aesthetically, it will be a huge improvement to the patient. And this is something that braces is very good at doing. All right, second option with orthodontics will be the clear aligners. What are clear aligners? Will be this clear trace that molds the teeth into the correct position. I'm going to pass down this one and we'll have a look, okay? So essentially, clear aligners are a more recent addition to the toolset of orthodontics, and they offer a removable, transparent, and more discreet look when it comes to the correction of teeth. It's invented by the Invisalign company in the United States, and one fun fact is that he's brought to Australia by Dr. Jeffrey Hall over there. And Dr. Jeffrey Hall is one of the best orthodontists in the country, and he is my great mentor who taught me everything about orthodontic. Okay, so this is what aligners will look like in the mouth. On the left, bit crowded. On the right is the finished version, okay? And if you look closely, on the top, we are actually still wearing the aligners, virtually invisible. This is not the case. Big gap on the left, and managed to close all the gap on the right hand side, and took us about 18 months for the case. And another case, this is a slightly older patient, but still managed to get very good result with just aligners. Okay, one big thing in the world of orthodontics is what we call growth modification. As I discussed just now, our teeth are housed in the top jaw and the bottom jaw. A lot of the time, what happens is that it may seem to be a tooth problem, but it actually originates from the bone. For example, sometimes we may see people with the top teeth a lot far forward comparing to the bottom teeth. Most of the time, it's actually because our lower jaw is too small comparing to the top jaw. With growth modification, we are not correcting the teeth, which is not the origin of the problem, but actually we are modifying the growth of the bone. In the example, we will be growing the lower jaw actually, which is the source of the problem. Many tools we can use for growth modification. It's called a herb splines on the left-hand side, and on the right-hand side is called the carrier distalizer. And I'm going to pass down an example of a carrier distalizer just for us to have a look as well. Growth modification is very efficient in correcting severe cases when growth permits and when it is indicated. This is one example of what growth modification can do. On the left-hand side, it is the case where our top teeth is a lot forward comparing to the bottom teeth. With growth modification, 100% correction. But it can only be done when we're still growing. More traditional way of doing things, headgears. Looks a bit scary. It's very good when it's indicated, but it is not very common. Don't be scared about this. Alright, so now that we've known a little bit more about orthodontics and our different options, let's talk about the process of getting started. With us, the process always starts with a consultation first. With the consultation, we'll find out what you need, what you want, and what we want to achieve by the end of it. Photos, x-rays, and the 3D scans will all be taken, As part of the free consultation, from there, we'll be analyzing your facial profile, your teeth, your jaw position, the health of your teeth, and the health of your gum. And from there, we'll be producing a personalized treatment plan for each individual cases. After the first consult, usually after about 2 weeks' time, we'll come back for the return consult, which is also complimentary. That visit is where we discuss all the options, the timeframes, and the cost of the treatment. We'll also have a 3D simulation to see what we are at the moment and what we will be achieving with orthodontics by the end of the treatment as well. After this, once we've settled on the plan, that's when the treatment starts. With orthodontics, first treatment always takes the longest. With braces, we'll be looking at sitting in the chair for about 80 to 90 minutes. Liners, slightly faster, about 50 to 60 minutes. That is the longest appointment of the entirety of the treatment. After that, very quick review, 10 to 20 minutes, every 4 to 12 weeks, depending on which stage of the treatment we are at. All right, some common questions when it comes to braces or aligners. One is, when is the best time to start? Okay, so according to the American Orthodontic Society, everybody should have an orthodontic assessment by the age of 7. It's not really a thing now, but it is something we are actively advocating. Comprehensive treatments usually starts from the age of 9 to 14, depending on the growth, but the key indicator is when we've lost all the baby teeth. Some people lose it a bit faster, some people lose it a bit later, but generally when all the baby teeth are gone, that's when we start the comprehensive treatment. Selected cases, we may start before all the baby teeth are gone, but there will be very, very specific indications for that, and it's only when it is required. If we pass the age, it's no worry at all. Right now, in Australia, 25% of all orthodontic patients are actually adults, so we can still get a very, very good result, even if we pass the age of 9 to 14. When the growth is the most active and the bone is slightly softer. Second question would be how long the treatment would take. Nobody wants braces for 3 years, that's for sure. But the key with orthodontics is that we need to move the teeth very gently and very gradually to avoid any damage to the teeth. So it will take slightly longer in certain cases, but it is the best way to protect the teeth while getting the perfect result. Simple cases, we'll be looking at about 6 to 8 months. More complex cases, 18 to 36 months. Again, light and consistent forces are the key to ensure safety and predictability as well. Many people will be asking this question, do teeth need to be extracted? We want to avoid extraction as much as possible. Not a pleasant experience, especially when we are slightly younger. But it is unfortunately not always possible. Of course, avoid it as much as we can, but there will be indications where the teeth have to be taken out to get a perfect result. One of the things that we really look at will be size of the teeth versus the size of the jaw. When our teeth are very crowded, it always means that our teeth are too large for our jaw. If the discrepancy is very, very big, trying to force that many teeth or that big of teeth into the small jaw will actually endanger all the teeth. As the result, those will be one of the indications that we may take out 1 to 2 teeth, sometimes more, but to preserve the health of all the other teeth in the jaw. One interesting thing is that our jaw has been rapidly shrinking for the past 100 years. All has to do with the kind of food we eat. 100 years ago, 200 years ago, much less processed food. Now McDonald's, KFC's, everything's a lot softer. So our jaws have actually been getting a lot smaller, while the size and the number of teeth have stayed the same. And this is exactly the reason why so many patients now require extraction for orthodontics comparing to 50 and 100 years ago. It's part of the evolution. Unfortunately, we can't fight that. If extraction is indicated, we'll do a very thorough discussion why it is required, or if there's any alternatives possible. Some consideration during orthodontic treatment. Orthodontics comparing to other forms of dental treatments, such as clean, fillings, or maybe a crown, is that it will take multiple visits and usually spread across 1.5 years to 2.5 years, generally. So it really means that we need to be committed to the treatments and attend regular appointments. The most important thing is that we really need to make sure that the teeth are cleaned properly during orthodontic treatment. Otherwise, One very common thing if we don't is to have the white spot lesions. What they are is what's being shown on the photos, where they have little white spots on the teeth after we take out the braces. Not the end of the world. They can be fixed, but it's best to prevent it. There will be mild discomfort while we move the teeth. Usually day 1 to 2 after getting the braces or the aligners is the worst. After that, it will be a lot better. So we just need to get through the first 1 to 2 days, sometimes the first 1 week. Retainers are a must after treatment to prevent the teeth from shifting and following our instructions to get the best result. All right, so that's pretty much everything I'm going to talk about. Now I'm going to have Tian, our treatment coordinator, our practice manager, to discuss cost and payment plans as well.
So everyone pretty much gets a personalised treatment plan once they come in and have their consults. As Stephen kind of explained the process, once we have that simulation and how long it's going to take for your treatment is when you have the exact cost. Because costs vary depending on duration of the treatment, how complex it is, any extra parts you need to have throughout the treatment. Of course, being we have health insurance, so good health insurance covers orthodontics, which is separate to general dental treatment, then we can claim that for you. You have the option to fully pay out of pocket, or we have what's called in-house payment plan option that we call Stripe. So there's no credit checks and nothing like that. There's just an admin fee of about $5 per month per payment, so it just means your admin fee might be a little more. We do have the option if you don't want to have to do that and you'd rather get a loan. We have a couple of in-house payment plan options for loans as well. The joy is that they do come with interest. There is the option also of superannuation. There are some strict guidelines when it comes to using a super when it needs to be related to acute or chronic pain, which is not always the case with orthodontics, so that one's very fine-lined of what we can offer to be able to use that. When you do come in and get a quote, pricing is transparent, so once that price is set, that's it. The only way that's going to change is say suddenly halfway through your treatment you need to get a filling done or anything like that. That's the only thing that's going to really be different. And then if you wanted to sit down and discuss payment plan options and things like that, you come and sit down with myself or have a chat with front desk who'll be able to walk you through all the different options available and how much those options are going to cost you as well.
All right, back to myself. So options after treatment. Orthodontics, very good at straightening the teeth, changing the position of the teeth. But occasionally, the issue is with the shape and the size of the teeth. In that case, let's say, for example, our front teeth are very, very small. After straightening them, they may still look a little bit off. If that's the case, to really get the perfect result, we may be looking at options such as composite bonding, which really just means a bit of filling to increase the size of the teeth, or if the teeth are excessively big, reducing the size of the teeth a little bit, of course within limits that we don't harm the teeth. When we are over the age of usually 20 or 25, we will be considering more permanent options such as porcelain veneers, very, very thin layer of porcelain on the teeth to change the shape or the size of the teeth if indicated. Whitening can be done after braces or aligners come off, just to make the teeth a little bit whiter, or missing teeth can be replaced with implants or bridges. Sometimes, when the bite is not quite correct, we can also do what we call a full mouth rehabilitation. This is where we use fixed prosthodontic work instead of using braces or aligners to change the bite to achieve a correct bite. With all this information during the consult, we'll be discussing this in detail with you if they're indicated. All right.
So we've been doing ortho for quite a while. You'll be surprised when you finish cases and it looks beautiful. But whitening, goodness, just changes the whole face, the glow. So it seems like the smallest of things, but it's part of, we don't charge extra or anything like that. It's part of braces, and it just really brings up the smile as an example, or veneers, or a little bit of bonding, or a little bit of filling, just to make it nicer. When we take braces off, sometimes you'll get discoloration as well if you haven't been cleaning very well. So Damien, you're always just very particular with your oral hygiene as well. So it wasn't lecturing for your sake. You don't want to get the braces off and there's holes everywhere. So but if that happens, then the whitening helps. And sometimes you need fillings because you haven't taken care. But from our side, we will let you know to be careful. It's very rare that we get those little white spots. You must have heard about those white spots after braces are taken off. Have you kind of know? Good. So obviously the ones have been brushing and taking care of the teeth. So And we have a little tagline, retainers are for life, nighttime for a lifetime. So teeth don't move. So we do use fixed retainer as well, like a little wire behind your teeth, so the teeth don't move, but we still always suggest retainers. Yeah.
After braces.
Yeah. So when you finish, so teeth will always want to move back to where they started. So you have to keep them in position. It's like holding them in position. So what we normally say is for the first 3 months, wear them all the time. They're like clear aligners. Did you see them? The clear aligners? They're clear. Nobody can see them. And so you just wear them all the time except eating or drinking. After 3 months, just nighttime for a lifetime. So if you have a party, for example, right, and you miss a night, it doesn't matter. Say when you wear them at night, if they feel tight, that tells you teeth are moving. If they're not feeling tight, goodness. So so you just got to work it out. You know how it works. Yeah. No questions at all. No. Yeah. So and age is not a consideration at all. So the oldest patient I've done is 76. So it's and she went off and found someone special. So well, thank you for listening. Please have some food, have some nibbles, and Damien and I will be around if you have any questions. Sometimes when there's all the lights and everything, it's difficult to ask, and on the side it's easier. So please feel free to. Thank you.